Welcome to the Catalyst Podcast. I'm your host, Charles FC. Joining me today is Mitchell Best, CEO of Vital Work Life, and Derek Bell, Vice President of Solutions and Clinical Operations, also of Vital Work Life. Vital Work Life is the leading mental health and well-being expert for healthcare organizations and their workforce. They've focused on healthcare since 2007. And today, their innovative solutions are leading the way in helping physicians, nurses, and entire teams address professional burnout, life challenges, and the barriers to seeking help. Gentlemen, welcome.
Hello.
So let me begin. Where are you based, respectively, Mitch?
I'm up in Minneapolis, and Vital Work Life's been here for over 40 years, 4 decades.
Oh, my goodness. Derek?
Yeah, I'm coming at you from the Mecca of wellness here in Stevens Point, Wisconsin.
Excellent. Well, the last time I was in Minneapolis is also the last time I was in Wisconsin. So Madison, to be specific. So this is a reunion of sorts. So again, thanks so much for taking some time. Let me just begin with some background. Mitch, you first, CEO. If you give our listeners an idea of role and responsibilities and how you actually came to this line of work.
Yeah, Mitch Best, CEO of Vital Work Life. I joined the company. It's coming up on 24 years. And what I often say is I didn't set out into this work thinking it was well-being. What drew me was the mission of the organization at the time. And it was really quite simple. And it was that we were in the business of supporting healthcare workers. And who are healthcare workers? They're human beings. They're people like you and me, who are taking care of everyone else, and they too deserve to be taken care of. That simple mission or purpose translates 2 decades later in that we partner with healthcare organizations around the country to measurably improve the mental health of their workforce. And that belief has shaped everything about the company and how we've grown and how we serve healthcare organizations and their workforces, Charles. And it's what's kept me hooked from the beginning. I've had this opportunity to become the owner and the CEO back in 2013. At the time, that wasn't a hard decision. The work matters. Healthcare workers matter to me. And if anything, the need's only grown since then. So that's a little bit about my story.
Excellent. Derek?
Yeah, I will. Thank you so much. I'll give you the short version because I came sideways kind of into the wellness field. I found wellness as a law school dropout. And in that period of my life where you're reconfiguring and recalibrating everything that you thought you knew, I came to the point where I really wanted to make sure that the path that I had in front of me involved the right people, place, and purpose. And that discovery has meant everything to me. And along that path, I landed in Stevens Point, Wisconsin here, which housed the National Wellness Conference, the inception of the field, the first academic program, the National Wellness Conference. And then I started working there and started being surrounded by and immersed in the field of leaders who really created this thing that we're talking about today. They were the ones that were on the forefront of mind, body, spirit connection. How do we improve workplaces to help people flourish? And that spoke to me, watching my parents be broken by their work. I never wanted to be in that. I didn't want that for myself. I never wanted to have to also apologize for what I was doing and like working in a place that meant something that had an impact in people's lives and flourishing. And so how can I best build skill sets pointed towards that? How can I help people be excellent? And in my life and in my professional career, my executive career, but also in my coaching career and in my as a teacher and as an educator, those are all threads that are very common. I can find that I really want to be rooted in my deep gladness. So I want to help people find theirs in spite of physical health, because we can't control certain things, but we can definitely support each other to try to do the best we can. And so I'm here in this capacity to do that for the most critical of our workforces and helping us stay healthy forever. And I've had a almost 30-year career in the wellness field now to help build that capacity for people to be great and do more, and really for everyone to be at the top of their license, top of their strengths, top of their capabilities.
The well-being movement has evolved significantly over the past few decades. Mitch, let me ask you, from your vantage point, what were the key inflection points that shaped the field into what it is today? You said 24 years ago, you came to Vital Work Life, and you mentioned what drew you to that field. So, and I'm sure Vital has evolved in that time as well. So I'm curious, what are some of those changes? How has this field evolved? What are the major milestones or inflection points?
Well, I think a few moments can really stand out. I think the first is, and it's a pretty significant one. And it's a shift when organizations leaders, when work groups, cultures, move from being purely reactive when there's a time in place for support and care, or a time of need, and transitioning that to proactive, care and support, proactive well-being strategies. When organizations, institutions, groups of people, communities make that shift, that it doesn't happen overnight. It takes time, and time sometimes equates to years. And within that, there's traction. So I think that's really one of those few moments that you have to almost kind of put your ear to the ground and listen for. So that's a really big shift that has happened in my 2 decades working with Vital Work Life. I think the second one is the emergence of data trumps. When organizations can actually measure, for example, measure burnout or measure engagement, measure outcomes, yet well-being then moves from a soft conversation to a boardroom conversation. So that is really significant in terms of a moment or a key inflection point. I think the third, and something that was really visible to all of us, was COVID. The pandemic compressed what might have been a decade of, a decade plus of what could be considered like a cultural evolution into about 12 months or 18 months, right? And it made the invisible suffering visible. Derek and I, we're here to serve healthcare organizations and their workforces, and healthcare workers within that time of COVID were on the front lines of a crisis, and the world was watching. So that was another one of those really key points. And that wasn't that long ago for any of us, right? And then I think the fourth, which is a accumulation of all of them, is the integration piece. Well-being isn't a standalone program anymore, and it can't be. Data from a well-being program or from any place in the organization that they're measuring, it can all be integrated. And so we're right now in this moment of integrating all of the programs and all of the data. And when it gets embedded, it's going to lead to us operating differently, operating in an elevated state. And that's what's really exciting, and why nearly 25 years later, it's really an exciting space to be in for Derek and myself.
Yeah. Derek, your thoughts?
Yeah, thank you. And Mitch hits on these critical stages in our clinical areas and working with healthcare systems and being part of design around how do we support people best. There's been several iterations of things that have been added to or have been tried, and that can be, as the Maslow created, like giving burnout a real name, and the quadruple aim added to, like, how do we design and how do we build infrastructure within a healthcare system around supporting the clinicians and the physicians best. And then COVID came, and what I can add in from my 20 plus 30 plus years, here in working, is we saw that also mimicked a lot of what we saw outside of healthcare too, in the development of worksite wellness programming, where it went into this era of behavior monitoring and strategies around some those health outcomes to try to reduce cost. And COVID just allowed us to understand that we had really lost the plot on the soul of what we're doing here. And that is getting to the root of using the right kinds of data to support the right needs that we have too. For a long time, we didn't think we could measure on the soft side the joy and flourishing and happiness in a meaningful way. And we discovered we can't. Not only can we, but we should. And that is meaningful because that helps drive the ROI and VOI data that we are already collecting. That helps point us in the right direction to say our workforce strength isn't just about the costs that we're reducing, but are we keeping the people that are doing the best work? Because those are the outcomes that matter most, because our patient scores are what are really critical. So we need to have the best doctors. We need to keep the best clinicians. And we can only do that if we have a culture that is really around a strategic sense of well-being. And that doesn't mean it's part of a benefit plan. It doesn't mean it's a part of clicks and ticks. It requires a paradigm shift to understand that this holistic approach is truly a holistic approach. And then getting to the point where we can have those, we're not getting lost in the data, but we're actually letting the data do the work that it should, because we can drive meaningful results that have the complete picture, not just one part. I think that was a realization out of COVID, was that we need to make sure that we're really measuring what matters most to our outcomes that we want and the kind of culture that we want. And so that's allowed data to operate differently, and has really seen a growth of focusing on those things that do matter to us, because that's something that we had lost along the way in this journey of integrating well-being into our organizations.
It's interesting. I usually have this conversation vis-a-vis wellness, well-being, as it relates to business leaders embracing this as not so much a nice to have, but a need to have. And there's been historically a great deal of resistance. And Mitch, you put your finger on some of these things, the data piece, the proactive piece, the visibility that emerged through COVID, where everybody was sheltering in place. And we all, no matter what level of the organization you're at, you realize how important well-being and wellness is to everybody's functioning, including your own. But one would assume that healthcare workers would be more sensitive to these issues, but it appears that was an evolutionary process.
Mm-hmm.
Explain that a little bit, because again, it's a little bit surprising that they're on the front lines. They know these issues and they know the impact it has on their ability to perform at their best. Why has it taken this long for to make those inroads, for people to healthcare professionals specifically to embrace this idea that they need this in order to function at their best?
Yeah, I think there's two things, that really have converged and made it impossible to ignore, Charles. The first one is the financial realities hit. And one example, and we can take any role in healthcare, but a physician, replacing a physician costs anywhere from $500,000 to over $1 million when you factor in recruiting, onboarding, and lost productivity. And that's not soft numbers. That's a hard business case, and that's in the boardroom. And at the same time, so that was the head, there's the heart. And the cultural conversation shifted. Mental health stopped being a whispered topic. Employees, so younger clinicians began expecting their organizations to show up more for them. And the organizations that didn't and continue not to, well, they're losing their clinicians to the ones that are. And so I said two. And then when you really think about healthcare, there's also a third layer. So I guess there's three, right? Clinician well-being is also directly tied to patient safety and care quality. This connection, it changes how health system leaders talk about this internally. And it needs to, and it ends up in the C-suite or in the board level. It's a board level conversation. So that is why it's a strategic priority in this decade. Derek, what are your thoughts?
Yeah, I think, there's a couple things that are at work. It makes it a challenging environment for well-being, in that you have what would, like you said, presumably a system of people that understand well-being, and yet they're the last ones to typically participate because they're so busy helping others. That speaks to the spirit of the vocation, the true, deeply meaningful part of the work, and any of the organization that has to run. And those organizations don't usually run to the best work-life balance of some of the staff that are working. And so having access and having the capability to reach into their work environment and create these mechanisms are several different kinds of layers. And then there's some outcomes that end up fine-tuning and helping us shine a light on what's most important, whether that's errors and patient safety, patient satisfaction outcomes, also turnover rates and leadership as a vehicle for this. There's all these different parts that are at play in a very complex system. And, it speaks to that, it has to speak to all those needs. And so I think that shift go back to that question of that shift culturally is I think everyone would say we've gotten to the point where a nice to have is now we've gotten past that. But now what do we do next is the real challenge and the problem to be solved for, and why we're having discussions like this and continue to work on that is the nuts and bolts, like Mitch pointed out, the math makes sense. Like you don't want to have turnover, you don't want to have errors, you don't want to have issues. So you have to create an environment where these things matters. And just like we talked about in just in the previous question we were going over, is there's also some value of our impact that ties into our ROI. And that cultural shift is about what is happening in that space. So how can we continue to create a narrative and the story of success around that we have a whole person environment that really supports people in all the parts of their life that that they can come to work and be at their best, and that the organization supports that. And so that creates an opportunity for us to, again, how do we measure that? One of the things that we have done here is also integrate that flourishing measure into our data sets to create that, because we understand presenteeism and absenteeism, those are definitely hard cost. Those are easy to define sometimes. They're hard to ask about, but when someone's not at work, when someone's not at their best because of errors and other things and conflict and all the different things that start to become issues within the workplace are exposed. But when those are exposed, those are tied to health and well-being. Those are neatly tied to well-being, and they're rooted in the culture of the organization, and oftentimes in where what I like to call the middle out leader-led strategy is, because that's where it's embedded, when your leaders are your strongest advocates for the experience, and it's not just housed in a HR silo off to the left and as part of a benefit plan, but it's actually that strategic priority. It's not a standalone program. It becomes part of leader training, it becomes part of onboarding, it becomes part of management training, and it's more than just the benefit level care. And that's something that organizations, they're struggling with that now, because they're trying to get into those spaces. And so what we, the data points to that too. If you look at like Gallup, who does all the surveys on this, and other groups that support this, is most people either leave or stay their job because of their one-up leader, the way that they're interacting with them, the kind of interactions they have with their one-up leader. That's not unique to healthcare. That's indicative across all kinds of workforces. So when it comes back to like, what about that nice to have to that shift culturally, that you need to change your definition around well-being to make sure that your definition is posited to support that overall strategy. And it's still not a health outcomes based or very metric based alone measurement off the side. It needs to be truly integrated across all the different streams of the organization. And that's the challenge, is really elevating and evolving the organization to get to that level so that everyone has a common approach. So we all can kind of speak the same language, and then everything starts to build out underneath that more appropriately into the betterment of that organizational culture.
Derek, you use the word flourishing. How do you define flourishing, and how do you measure it?
Well, there's several different approaches. What we look at are really, how can we and again, asking people, how do you feel about meaning and purpose in your work? Do you feel like you're fulfilled? Do you feel like that you're being supported? Do you feel like you have the needs that you have? So like, do you feel that you're being cared for? Do you feel safe? And that isn't just about health safety. That's also about psychological safety. Do you feel like your values are not being, rubbed up against in your work environment? You feel like you're in a value-based work culture where you can really feel like that you're valued as a person, but that also your deep values aren't being compromised in the work that you're doing. You're not having to be challenged yourself. And the composite of that, through those, we get a sense of how someone's feeling. Do they feel like they're going in the right direction? Do they feel like their work is meaningful? Do they feel like they're growing in their work? Do they feel they're supported? Do they feel like they're accomplishing? And do they feel like they're being recognized for that? Do they also feel like there's opportunities for that continued growth as well? And so, do they feel stable? Do they feel financially stable, physical stable? Do they feel, again, that they are psychologically safe? And the sum of those can give us a real measure around flourishing. And when we see that kind of growth, for us, it's important to help drive people into the right kind of environment that can make that better.
Anything to add to that, Mitch?
I think what Derek said was spot on, and what's really important when you measure it is when people are reaching out and seeking care and support, that, we get a baseline of where they're at, and that after a short period of time working with professionals, whether that be in a mental health capacity like counseling or coaching, that we understand what has truly improved in their life, from a sense of belonging, a sense of safety, for two examples, right? In measuring that and being able to share that back with them and talking about that improvement, and also in a non-identifiable way, sharing it back with the institution that's making an investment, right? To say that you matter, and so that's the other key to all of this as well, is to understanding, not just, is not just what's happened, but the story behind it, like just that part. That's what I've added. So thank you.
To that, I'd like to go a little bit deeper as far as how you interact with healthcare workers, talking about gauging their sense of psychological safety. How else do you support healthcare workers? What's the nature of the interaction? Is there a certain cadence or there are certain tools? Is there, for instance, a vital life desktop that people enter information and supports sustained engagement? How exactly does that work, Derek?
Yeah, there's several layers to that. So one of the great things that we have breadth and depth in is being able to accommodate several kinds of needs. And that goes into our holistic approach. And so on the front end, that in our, what I like to call like in our front door, we're asking and trying to get the right kind of information to support them. So we're identifying, does someone need really crisis level to counseling support? Is this something where we need a little bit of support to get to a good place where we're seeing them feel better about the direction they're going? Then we also have our coaching environment, and in that coaching environment, we know research base can point to, after 4 hours, 4 interactions over a month period of time, there's some cadence there that you start to see the growth. And we see that our success is measured over those lengths of times too. And that's an environment that requires enough time to be spent in the coaching environment to be able to have an outcome that's meaningful and important. We also provide a whole host of work-life services. And that's something that we have, especially for our physician community, we know that they need to be at their best. So if they're on their way if they're dropping off their kid at school and their kid pukes in their car, they need to get that taken care of so they can make sure they can get to work, and we can take care of that for them. If they need to plan a vacation, a wedding or something, the time constraint, the time restraint, that continuum for the physician and the clinicians of all, in the healthcare setting is a challenge. It is a barrier, and it's not necessarily going to be something that goes away easily or is managed easily, because the demands on our healthcare workforce are strong. So we have to provide that as a servicing group to their betterment, to make sure that we can improve their flourishing and well-being. We need to make sure that they have access to tools that help them with their lives, so that we can be more meaningful to them. We also are starting to see, in one of the critical areas across, it's an area of concern and growth and opportunity for us to be better at, is also around social determinants of health. And on the public health side, I mean, we've been there forever. In how that is managed within an organizational healthcare setting is a challenge, because there are people that are coming from different tax bases and have different resources and just different areas. And we need to make sure that everyone has the access to the things that they need to be able to continue to be in their career, in their organizational setting. And oftentimes that's daycare, oftentimes that's elder care, oftentimes that's my school shut down for the day. What can I do? Or I'm moving to a new environment. I don't know anything about these resources. I have a kid we've had people ask us questions about finding sports and recreation teams for their kids with special needs. Life affirming, life changing level pieces that kind of fall under the radar oftentimes of the work, but that's what's most meaningful to that physician, that clinician. And so for us, it's important to make sure that we're providing all of that to the user as they're coming into our environment through our app and our portal, and how they're interacting with us, and how can we be better predictive and help them and guide them too along the resource line that we have.
Mitch, let me ask you a question. This may be overly general. If it is, I apologize. But is healthcare work more or less stressful today than it was, say, 5 years ago? And if so, why?
And I think the why is probably the most important thing. I think it is more stressful, Charles, and it is more stressful because, there's a compounding nature of the fatigue of experiencing burnout, of experiencing stress that's chronic, and the constituents that can stay within the healthcare setting and that are experiencing all the things I just described are seeing their colleagues self-select out. And so they're left standing. They're surviving. They're not necessarily they're not necessarily thriving though. And so that's why it's worse. There's a compounding nature. And within all of this, over the last 10 years, it's been very well cited that there are shortages of nurses. There's shortages of techs. There's shortages of slots in medical schools, in residency programs, and with physicians. And all of those those shortages are growing, while those accessing healthcare is growing exponentially with an aging population in the United States. And so the problems, that we all face in healthcare and the organizations, and it's greater. And so that's the why behind that. Some of the things Derek is talking about really speak to, it's important not to approach it with a one size fits all or a generic solution or approach and expect it to work. The barriers that healthcare workers, clinicians face, whether through the stigma or the time constraints, the culture, they have a culture of self-sufficiency, pull myself up by my bootstraps and just grin and bear it. Those are barriers that aren't necessarily in place in every other industry. And then when you factor in that they are caring for patients, it matters more. So that's what I would say in terms of answering your question, Charles.
Derek, your thoughts?
Yeah, thank you. I mean, Mitch covered quite a bit of ground on the varied kinds of issues that when we talk about stress today, I'm careful to say something's more stressful than it used to be, but I also want to recognize that I also studied sociology. So I tend to look at organizations first, and an organizational stress today is greater than it used to be. The financial demands of healthcare are so great, and the amount of mergers and acquisitions and rural health trying to stay afloat and different, the business of healthcare has changed so much that that stress gets put into the employee groups having to do the work. That's meaningful. We need to make sure that we're really understanding that, because that leads to the impact and all the things that we've just been talking about. People are working in an environment that's more stressful, so it makes it more stressful. And there's two things that I think we have to recognize. Is one is that there's some demands that are on that are coming, as Mitch pointed out, about some of the work shortages that we're anticipating. There's data around how many physicians that we're losing, or in other clinician groups, nurses. The lack of care providers in general is something that we have to understand. It's also going to have an economic impact on our healthcare system. And younger physicians and clinicians are also recognizing that they don't want to maybe put the type of effort into the length of time spent in the work environment. So it's not about being the best physician, but it's about not giving up my whole life to be in this space when I want to do these few other things too. And that is the younger generation is coming in with a different sense of work-life issues that they're thinking about. And I use the word they have work-life ideas that become an issue for discussion around the environment. Is how can we accommodate and be in a more flexible environment. And organizations have been, and this has only happened during COVID too, with more flexible scheduling type options. With working in a large healthcare system at that time, we found that our nurse retention rate was better when clinicians could make their own schedules. So there's some practicality to some of the reasons to how we can reduce stress. Some of the things that we can be thinking about that can help reduce it. Doesn't take away the stressful nature of the work, but it makes the work environment less stressful. And that is where these concepts around well-being, both of what we know and also the influence of what, we like to call an umbrella term, the soft side of it, how we feel connected to our colleagues, some of the more, those team-based things, or my individual, do I feel like I'm growing? And do I feel like I'm flourishing in this work? Those matter because those can be stress reducing mechanisms within that work environment to help mitigate and do the best we can in an environment that's always going to have a level of stress to it that won't change.
I'd have to think that to the extent that Vital helps healthcare workers mitigate stress, maintain more balance in their work and in their lives, that healthcare organizations view the services and tools you provide as a recruitment and as a retention tool. Is that the case?
Yeah, yes, it is. And there's an and with that, because with each and every healthcare leader we talk to, Charles, we're asking them, what are they struggling with? And how are they prioritizing those struggles? And if they were to take their list that they prioritize, would their colleagues agree with that? Would their CFO say, yes, this is our organization's priority? So we are inquisitive. We challenge with respect our clients' initiatives and priorities, because we want to bring forward curated, custom, evidence-based, data-driven resources and services that will fulfill what they're ultimately saying that they need to get accomplished. And as what we've learned over 2 decades is that we have proven out a process that works. We call it the Vital Work Life Guide to Client Success. And there's goals set. There's KPIs that we're tracking. And when KPIs go off track, it's an opportunity to say, hey, what's going on here? Are we fulfilling what we promised? Are you meeting us in order to make sure that a group of nurses, at Market 2 understand what's available to them, from that perspective? So it's really important to take that into consideration, because there's areas of well-being that don't get enough attention. We've talked a lot about this afternoon or today, clinicians are burned out, patients care suffers from that. That's well documented. It's certainly not speculative. Derek also touched upon something that we also believe wholeheartedly requires more attention, and that's the leadership and the leader support. Because when there's clinicians that are burned out, that means that they're disengaged, and disproportionately they are leaving their institutions, and sometimes to the detriment of our country, they're leading the profession in and of itself. But what that immediately removes is mentorship, institutional knowledge, and the very people who would have grown into tomorrow's leaders, right? The folks that we would be consulting with. And so that's something that we have a lot of energy toward, solving for. Right. And bringing and listening to, and sometimes folks aren't asking about that or saying that's their top priority. So Derek and his teams that report up into him across the country, we're listening for that, and we're weaving that into the resources and services, because we know at the end of the day, there's a downstream societal consequence if we don't. This clinician shortage is only deepening. And if we don't address it, if we don't address the fact that people are being driven out of the profession of healthcare, there's simply going to be healthcare system without enough people to run it. Mm-hmm. And that, it seems somewhat dire, and yet it's the truth. That's the heart of the matter. And so I would add that to, in terms of, yes, people are raising their hand. They're looking for how do we approach this? And we are very inquisitive to understand what their top priorities are and how, and we'll help with them with that.
Which conveniently tees up my next inevitable AI question. And I'm going to put this to Derek. What are the impacts of AI on the field from the standpoint of healthcare workers using AI, generative AI, AI embedded in the tools that they're currently using, and some of the uncertainties and the anxieties that AI is introducing? And maybe even from a leadership standpoint, to the extent that there's a shortage today, and there may be a shortage in the near future of healthcare workers, to the extent that AI could, fill that breach, if you will. I know it's a very big question and it go down, any number of avenues, but what are your impressions of the impacts of AI on the field?
Yeah, that's a great question. I don't know if we have any where it's used so wild, it's used across the breadth of the organization. I think we're in this stage where we will learn impacts and they're iterative, and we will start to see deeper impacts being made by its use. And you touched on like a couple of the key areas that we focus in on is, can it help on the upside, reducing some of what we see with EHR, EMR, using it for note-taking, charting, education, documentation, using it as in ambient documentation tools, reducing burnout, because it's just, we're able to move time around differently and be spent more in patient care. That's the goal. So driving those systems use AI to be better at collecting information so that we can have our clinicians spend more time with people is critical. So several methods of approach there are all going to be very important because they're going to reduce burnout in one area and hopefully not replace it in another area. So it's going to be helping there. But there is there's digital literacy gaps that we have to be accountable for and use of it. So that's something that right now is like probably priority one for most systems is we can use it. It's almost like there's a lot of use cases out there, but we're just not sure which ones we're going to go to right now. And can our staff handle that? Can we as an organization adopt a strategy that's meaningful and impactful? And can we use it accurately, effectively? And that's probably a lot of the stressors. I grew up on Saturday Night Live, and I'm always reminded of the skit about needing to buy robot insurance. And it's just one of these things that we're a little fearful of what we don't know, but as we start to become better users of it, and we can drive what we want out of the content, we find that there's a lot of incredibly helpful uses for that. The key area that I think is probably the one that we focus on a lot, and we should ask ourselves all of these questions about the human in the loop environments that we're creating in healthcare. And that's not just on their side in the organization in the healthcare setting, but also on our side as the well-being and mental health care provider too, is how, where, and what best supports our clinician community, our physician community, so that we can drive our best care to them too. And so it's, I think the impact is we're going to start, hopefully now there's been enough of an adoption that we're starting to see both the positive and negative impacts of its use so we can curb what we don't like about it and drive it to the best ways we can. But one of the things that I know it's helpful for is really aggregating information to help identify trends in a quicker way. What could be done in months can now be done in a few seconds. And that can help an organization identify gaps quicker and then develop strategies and responsive things around that to help improve the work environment.
Yeah, by the way, I'm going to ask Mitch for you to weigh in on that too. But before I do, I very seldom have an opportunity to make book recommendations on this podcast. But there is a great new bio on Lauren Michaels. Highly recommend. If you're an SNL fan, you got to check it out. But we digress. Mitch, your thoughts on AI and its impacts, both positive, negative?
Well, as Derek knows, this is something I've been thinking about quite a bit. And just on a positive note, I mean, a lot of what Derek said, there's real potential for clinicians to have a reduction in administrative burden. And administrative burden is one of the key system drivers to stress and burnout in the healthcare profession. And AI can also expand access to well-being support. And that's who Vital Work Life is. So we are, yes, are we a mental health and well-being company? The underbelly of us is we're a software and tech company driven by AI in 2026. So we have an innovation roadmap that includes proactive outreach, smart check-ins, personalized resources, all driven by AI with a human in the loop, for the compassionate support and care. Now, the risk I'd flag is that AI adoption and it's accelerating faster than change management can keep up, right? And so, clinicians, all of us is just as people or as human beings are being asked to integrate yet another new tool into already strained kind of workflows, whatever organization or institution we work in. And so that can create its own anxiety and risk. And so the organizations that are going to get this right are the ones that are investing in human readiness alongside the technology rollout. And that's what some of the smartest technicians and C-suite leaders are taking into consideration. And oftentimes I hear it and I'm just kind of like, whoa, the tech is going to be the easy part, folks. It's the culture change with this tech that's going to be the work, the real work for all of us.
Right. You see this in a lot of surveys. It's really how you're adapting it more than the technology itself, how you're incorporating it. Leaders being more proactive and making sure that their workforces are integrating it. And obviously, there's a lot of issues also where you have leaders foisting it on their workforce, which creates an anxiety. So there are a lot of issues that sort of are commingled with AI adoption. Last question I want to ask. If you're advising healthcare leaders today, what would it look like to design a system that truly supports long-term sustainability?
There's a part of me that wants to flip the question on you, Charles, right?
Uh-oh.
So instead of asking...
That's not allowed. Well, I thought you read the bylaws.
I'm of the camp that ask for forgiveness versus permission. So asking people, asking how to help people manage the stress of their environment. Let's instead ask what's creating that stress in the first place and build from there. That leads to long-term human sustainability. That leads to sustainable systems that you can measure, and that measurement is what's going to matter. That means that tracking well-being alongside productivity, and it won't just be the bonus metric. So that's my kind of short 2 cents to just kind of, be somewhat provocative, if you will. Derek, what are your thoughts?
It's a great question. I have a lot of thoughts. So I want to keep it to like a couple really good critical key points that I've seen in my length of time and history in this field and working on the healthcare side for the bulk of it. One is, my concern is that we got to make sure we don't make the mistake of presuming data is strategy, because we can collect any data point we want and it becomes a giant mess of data. Data can help build arguments, can identify gaps, friction points. It's the evidence. And sometimes we can have data blinders and become very myopic. And that's been true if you go through the whole history of the wellness field. The more data we collect hasn't always been the good thing at first. It takes a while to sift through that addition of data that we can collect. Like I remember, when the Healthcare Act added outcome measurement programs, we started measuring more. That actually turned people away from wellness quite a bit, because now we became policing behavior people as opposed to wanting people to live at their best. So I want to make sure that when we were mindful of that, there's some things around well-being that are measures that can inform what a strategy can look like. But when well-being truly looks different to everyone every day, And that's a largely an ebb and flow of your day-to-day experiences in your organization with people and the parts and doing the work and moving. It comes back to one critical element. And there are actually two things that I would say are the most important in the strategy. One is, what is your definition of well-being? A lot of organizations fail that one right away. They don't have a consistent definition of well-being, and it makes it hard to really build a strategy if you don't even know what you're talking about in the first place. Two is, leaders and your middle management are going to be the most important part of that program. So what are you arming them with to help support the cause at large? And so a lot of times, a lot of wellness dollars are spent outside of leadership development and making sure that they're as healthy and capable as they can be well, especially we see in the work we do. We do a lot of leadership consults just to help them de-stress an environment that's stressful. And if you don't have these things built and baked as part of your leadership development, then all those other things we just talked about, losing staff and having the other errors and all these different things that we measure, the best impact could be building healthy leadership. And reminder that burnout is a lagging statistic. So what I always encourage is that even when we put in like positions like CWOs, that doesn't mean no one else gets to do the wellness stuff anymore. And sometimes that's what organizations think. They're like, oh, we have a CWO, they have wellness. If wellness is your strategy, then it shouldn't be in one position or it shouldn't be in one area. It should be threaded across the organization and embedded so that everyone is playing a critical role in how we handle it here, because we all work here. We all want our home to be the place where we're thriving. So we're not going to leave that to the stewards of well-being over in HR down the hallway. We all have a role to play in it. And that comes back to the art and the science. And so sometimes we get caught in the science because it's all the data, but there's an art to using that data effectively to make sure that you're really building well-being, defining and creating that environment for success with how you're even talking about it.
Yeah. And what I'm hearing is that it's not necessarily the data per se, but how that data, as you say, is used. And I mentioned AI. There is one way leaders could present AI, and another way. So one way is say, here is a great tool or set of tools. Use it as you will in your work, or foisting it on the employees and saying, this is the way you need to use it. So I would think the same thing goes for well-being. Just like everybody, it seems to me, has a learning style, right?
Mm-hmm.
Everybody sort of has for lack of a better way of putting it, a well-being style or a wellness style. What works for you may not work for me. So an organization may have a philosophy and an approach, but even so, as you drill down to the individuals, each person is going to have different issues, different things that they're going to respond to, and different things that they're going to adhere to.
Yeah, that's conceptually what has to happen. Now, the hard part is really getting there, but I'm always reminded, Bill Hetler created the first 6-dimensional model of wellness. When people would ask him because wellness models can become a competing industry in and of themselves, when Bill was asked which one should you use, and he was the one that wrote the original 6 dimensions, he just simply said, use the one that works for you.
Right.
So programming around that becomes an infrastructure and a choice architecture around the different things. But you pointed at it directly in that we can't be so narrow pathed in how we're defining something for something that matters to everyone. So that's why we need to make sure that strategically we're thinking of everyone when we build a well-being strategy, and that we're providing access, that we're making sure that we're supporting their lives as much as their work, and that work support is meaningful and impactful to the organization.
Yeah, no, well stated. Mitch, any closing thoughts?
Thank you for your time. Thank you for investing in this podcast that takes really important topics and you go deep on them. I think it's really terrific, and I think the name is spot on. The Catalyst.
Yes. Well, thanks, guys. I really do appreciate it. And this is the first time we've addressed this particular issue, the well-being of healthcare workers and burnout and all the other issues that they're grappling with today. So I really do appreciate it. This is an incredibly worthwhile conversation to have.
Yeah, thank you so much.
Thank you. Today, I spoke with Mitchell Best, CEO of Vital Work Life, and Derek Bell, Vice President of Solutions and Clinical Operations, also of Vital Work Life. This is Charles Epstein for the Catalyst Podcast. Thanks for listening.